you'll see on the suction catheter, it's kind of got a U shape. You see how it's kind of got a U shape? The reason why it has that shape is so that it'll go into the trachea easier. Also on here, it has a little eye on the side. So there's a hole opening on here, and then there's a little opening on the side, which is called the Murphy's eye. The Murphy's eye is so that, let's say I had anything occluding the tip, suction would still be able to be provided through the Murphy's eye. So endotracheal tubes, suction catheters all have a Murphy's eye on the side of them, on the tip. What position? Say it again. Did you have a question?
No, I was saying the Murphy, it helps with suctioning as well.
Yeah, if the tip is occluded. So it's still, the Murphy's eye still provides suction even if the tip is occluded. Okay, and then what position should the patient be in? Usually the patient's going to be in semi-Fowler's or high Fowler's position. Semi-Fowler's is 45 degrees, high Fowler's is 90 degrees. So they'll either be in 45 or 90 degrees. And let's see, what's next? Where can the catheter be inserted? It can be inserted to the left nair, the right nair, or even the mouth. So let's say you're not, I would go with the nares first, and if you can't get into the trachea through the nares, sometimes patients have deviated septums and you can't get through, you could go through the mouth. So you could go through their mouth. Because remember, the nose and the mouth, neither one of them are sterile. It's just the lungs that are sterile. How do you know? What are two, if I insert my catheter, what are the two places I could be? Well, where do I want to go, first of all? Yeah, so the trachea or the lungs. Where else could I go? Esophagus. So the only two places I can be is either the trachea or the esophagus. Now, how do I know if I'm in the trachea versus the esophagus? Well, one way you would know if you're in the esophagus is, one, you don't have a cough reflex, and by the type of stuff you're suctioning out. So if you're if there's no cough reflex and you're suctioning out, sometimes they're getting tube feedings. You can look at what they're getting, the color of the stuff that they're getting fed, or if it's like a fluorescent yellow, like stomach acid, you're probably in the esophagus and you're not in the lungs. Or if you're suctioning out like carrots and peas.
Yeah, nasty. What size is this again? This is 14?
14 French. All catheters come in French sizes. So this is a 14 French, which is normal for an adult. Okay, so when you come to this station, what you're going to do is, so you're going to practice setting it up. Use sterile technique with your gloves, putting your gloves on and suctioning your mannequin. And suction a couple times, and then once you're done, you can throw the kit away. So once I'm done suctioning,